Today we will discuss about pelvic inflammatory disease. The definition: what is pelvic inflammatory disease? It is a subacute to chronic infectious disease of upper female reproductive tract, like salpingitis and endometritis most commonly. The young classic patient presented in OPD will be young female sexually active with multiple partners, usually more than one. It is the leading cause of infertility and ectopic pregnancy. That's why the cervicitis is not included in PID because of these two. Because the cervicitis cannot cause infertility and ectopic pregnancy, while in PID these are the most common complication: infertility and ectopic pregnancy. But if the cervicitis is left untreated, then it can lead to PID. Okay, the most common organism, it is usually polymicrobial, but the single most common cause is chlamydia, followed by gonorrhea in sexually active female. While in virgin female, the most common cause is usually TB, while in postmenopausal female with PID, the most common pathogen is E. coli. Let's discuss the presentation and diagnosis. How will you diagnose? Is most of the patient, let's suppose this is abdomen, most of the patient will present with lower abdominal pain. The pain is and crampy, usually dull and crampy. Beside this, there will be uterine, adnexal, and cervical motion tenderness. And whenever a patient came with a one, this features lower abdominal pain. Second one is this, and the third, absence of competent diagnosis. What does this mean? Like the patient has no appendicitis or ectopic pregnancy, then this patient should be treated for PID. Additional features which can help us in the diagnosis of the patient are abnormal uterine bleeding, mucopurulent vaginal discharge, high ESR, CRP, and fever greater than 101 Fahrenheit. Okay, now let's come to the treatment. A patient came with the PID, you diagnosed it, then what will be the treatment options? Mostly treated as outpatient. Mostly PID patient is treated as outpatient basis. In this case, what you will prescribe injection ceftriaxone 250 to 500 mg IM single dose. But if the weight of the patient is greater than 150 kg, then we can give ceftriaxone 1 gram. If the patient is allergic to this one, then we will give azithromycin. In addition to the above injection ceftriaxone, we will also prescribe doxycycline 100 mg BD plus minus metronidazole 500 mg BD for 14 days. Okay, but when certain features are there in the patient like fever greater than 101 Fahrenheit, suspected abscess on ultrasound, okay, peritonitis features, recent intrauterine instrumentation, WBC or TLC count more than 15,000, or the patient is drug abuse, In these circumstances, fever, suspected abscess, peritonitis features, uh, recent intrauterine instrumentation, and TLC greater than 15. In these circumstances, you will admit the patient and start IV treatment. What will be the treatment in this case? We usually prescribe injection cifoxetine 2 gram IV QID. Okay, with doxycycline as I have told you above in this treatment 100 mg oral or IV plus minus metronidazole. Okay, this will be the treatment for this patient. Is if the PID is left untreated, then the chances of female infertility in ectopic pregnancy are high. That's it. Thank you.